So good afternoon, everybody, and welcome to this webinar with Dr. Tracie Miles. My name is Lavinia Winch, and I'm the ambassador for Yes Organic Intimacy Products. At Yes, we're passionate about women's health, and for the last 15 years, we have been talking loudly and clearly about the importance of vaginal and vulval health through all stages of our reproductive and post-reproductive lives, and helping to lift the taboo around the topic. The Eve Appeal is the leading UK national charity funding research and raising awareness about the 5 gynecological cancers. That's womb, ovarian, cervical, vulval, and vaginal. And every year, the charity runs the Get Lippy campaign to provide information, raise funds, and to get everyone talking about these cancers. Now, I should add that I'm not normally used to sporting bright Lippy, but in the spirit of the campaign, I've made my best effort. This pink Lippy is about the best I could find in my makeup drawer, so apologies for not managing anything brighter. This webinar is free, but if anyone feels able to donate to the Eve Appeal, then please do visit the website. At Yes, we're really proud to be supporting this year's Get Lippy campaign, and so we invited Dr. Tracie Miles to join us for this webinar on managing the long-term effects of gynecological cancers on vaginal health and sexual well-being. Our paths first crossed back in 2012, when Tracie found that the Yes range of lubricants and moisturizers were effective in restoring some comfort for her patients following surgery and treatment. And we've kept in touch ever since, sometimes meeting her at cancer conferences, listening to her brilliant talks, and often asking her advice on behalf of our customers. So the aim of this webinar is to provide information about the possible side effects of treatment and to give guidance on how and where to seek help and to manage the symptoms. And before I hand over to Tracie, I'd like to tell you a little bit more about her background. So Tracie is a gynecological oncology specialist nurse with over 38 years of experience in the NHS. She sits on the council of the British Gynaecological Cancer Society, is a member of the All-Party Parliamentary Group Committee and the NICE Specialist Committee, as well as an honorary lecturer at the West of England University. And Tracie is also the information specialist nurse for the Ask Eve service at the Eve Appeal, more of which later we'll tell you about that. So a huge welcome to you, Tracie, and thank you so much for joining us today, as I know that you're an extremely busy person.
Thanks, Lavin, and hello everybody out there in cyberspace. So apologies for my lack of Lippy. I haven't got into this Amazon buying things, and red lipstick hasn't come through the door for me, but I'm getting Lippy with my badge here. So now, one of the things that I'm good at is talking about post-care after surgery, after chemotherapy, after radiotherapy, and not so good at the techie thing. So let's see if this will work. So I'm going to share my screen. And I am going to find a talk, and I think we've done it, Lavinia. So brilliant. I'm going to go into full experience mode so you don't see what I'm going to say to you next. And does that look good to you, Lavin?
That looks absolutely brilliant. And I'm going to turn off my camera so that nobody has to watch me while you're talking.
Oh, bless you. So what have we got here? Managing the long-term effects of cancer treatment on vaginal health and sexual well-being. There is so much to talk about here, so I'm going to do it in a sort of summary style, and at the end of the slide deck you'll see how to get hold of me at Ask Eve with my colleague Karen. So 5 gynae cancers. Now Lavinia nailed it by telling you there are 5 gynae cancers. A lot of people think that there is only one, and they've heard of cervix cancer. Sadly, there are 5 of them. We're going to cover those off. I'm going to talk about signs and symptoms in a very general, broad aspect, talk about how common these cancers are, have a look at some of the different treatment options. Really want to focus today on the long-term effects on intimate health and sex. So important and so often not discussed. Nothing is taboo here today. Solutions, we've got some, and some ideas to where to go for health, help and support. So yeah, 5 gynae cancers. Now, the most common is womb, then we've got ovarian, cervical, vaginal and vulval. Now, I'm going to start with ovarian because that's the one that is the most non-specific with its symptoms. So if you look up in the top left hand here, You'll see bloating, pelvic abdominal pain, feeling full, feeling a bit sick, change in bowel habits and needing to wee a bit more often. Well, that's me after I've been to visit a friend in Manchester after a week and eaten too many curries. Now, clearly I can't do that because of COVID at the moment, but that's what happens to me if I go and visit my friend and eat too often on the curry mile, and it doesn't make me think gynae. So the key thing here is with those symptoms, it's when they're persistent, 3 weeks or more, and you can't link it to anything else, just let your GP know. It's probably nothing, always worth getting checked. The other cancers all usually have a signal bleed, or when I say bleed, that could be a discharge. So it's not necessarily the bright red you see of my Lippy shirt here, or the bright red on that infographic there. It's not necessarily the snow white moment of bright red blood on a panty liner or a white gusset. It can be a change in discharge. So any change in discharge, whatever it is, get checked, girls. It's probably nothing, once again, but worth getting checked. Now, if I labour to the point too long on all of these different cancers, we're not going to get to the nitty gritty, which I want to talk to you about, which is sex is enjoyable after cancer treatment if we help you with it. So what to remember is this is being recorded, and so you can look at this again and look at the other signs and symptoms in more of a minutiae. And also you can come to us on the Ask Eve website, and also our friends at Yes are super helpful. And if they don't know the answer to something, they always come to us. Works really well. So the 5 cancers, I think it is worth mentioning here that there aren't all the same, as in occurrences and ratios. So the ovarian cancer actually is the second most common. Womb is the most common. And Lavinia's got a secret about that. She promised me she'd tell and reveal some all about why women do need to go and get bleeding checked. So I'm going to remind her of that later, because womb cancer is the one that is the most common and the one that is the least picked up often because women normalize bleeding. Lavinia's my secret agent, and a story later, Lavin. There, I've asked you to do that, and I know you'll do it. Cervix cancer. Girls, women, do go and have your smears, your cervical screening. It's the same thing when invited. It is the only program we have for screening for cancers, and it works. It saves lives. If you really don't fancy going and having that smear, totally get that girlfriend. Give us a ring at the Eve Appeal, and we'll talk you through tactics of how you can do that. Vaginal and vulval cancer, far more rare, but if you get any changes in your vulva, whether it's an itch, a scratch, a bump or a lump, just get it checked out. If nothing else, to get more comfortable. It is very rare, but really important to get checked. Vaginal cancer, much rarer still, but any changes in your vagina, a discharge again, or if when you're putting a tampon in, something feels different, or if you're putting your fingers inside during sex, or if your partner says it feels different, just get that vagina checked. Okay, so treating the cancers. When Lavinia and I were talking about this, we had a very busy page going about all the different things that can support women to have their treatment. And then we decided, actually, we just nail it down to the 5 cancers, and I'll go through them very quickly, hopefully not too quickly, and do ask questions either in the chat box. Lavinia's going to moderate those later. We've already had some pre-questions sent in. It's great to have everybody interested today. So essentially, cancer is treated in one of 3 main ways. She's either going to have surgery, radiotherapy, or chemotherapy, or a combination of all 3. And then she'll go on to a follow-up or a monitoring program. So, starting with womb cancer, if a woman reports the signal changes, that discharge or that bleed when she's not expecting it, early enough, so early diagnosis saves lives, then generally we can treat a womb cancer with surgery alone. I am not negating that going through a hysterectomy is a simple thing. It's an enormous thing for anybody and the families that care for them. But if reported early, surgery is often the only modality, the only treatment we need to treat a woman with womb cancer. For some women, we will add in radiotherapies, a kind of belts and braces, what's called adjuvant treatment. And for some with a rarer sort of womb cancer, we might look at chemotherapy. With ovarian cancer, we will always, nearly always, for at least 80% of cases, so unless it's a very early stage cancer, we tend to see these cancers at what we call stage 3 and 4, more advanced, because the symptoms don't declare themselves until then. Our patients will go through a combination of chemotherapy and surgery, and that's generally how we manage ovarian cancer, and then she'll go on to follow up. Cervix cancer, just like wound cancer, if we get our screening smears done, then it may be that treatment can actually be done in an outpatient situation during the day, not even coming in for treatment, not even coming into hospital for an overnight stay. If a cervix cancer is slightly more advanced, then usually surgery will manage the treatment, will be the treatment of choice for our patients. And another one of my secret weapons, Karen Hobbs, who you'll meet on the slide at the very end of this, had surgery for cervix cancer, and she's alive and kicking, and my partner in crime in the Ask Eves information service. So she's the girl to call if you've got any worries as well. Number at the very end. If a cancer is more advanced in cervical cancer, we can still treat to cure with chemotherapy and radiotherapy. So it's really, really important, even if you're frightened, which I understand you will be, of any symptoms that you have, to get those checked, because we can treat you. Vulval cancer is simply a skin cancer, and that, if reported early, can be treated with surgery under anaesthetic, so it doesn't hurt. And if left a little bit longer, which of course it can be embarrassing, you might think it's thrush, you might think it's something else, so you leave it, we may look to needing chemotherapy and radiotherapy. So the earlier you get checked, the easier it is to treat you. And the same goes for vaginal cancer. Now that's a very big overview there. There are other treatments that you'll hear about that I am more than happy to talk about through with you, Ask Eve, which are called targeted therapies. So those are therapies like immunotherapy or personalized treatment, where it's not actually, the medicine isn't actually cytotoxic, killing the cells, but it uses the body's defenses in different ways to actually kill off or to hold off the cancer. So lots to talk about, and I'm always there for you at Ask Eve by email or phone. Okay, what I was really keen and so delighted that Lavinia wanted to talk with me to you about vaginal health and sex, because although it's an easy conversation for Lavinia and I to have, because that's what we've been doing through our professional relationship and what's become a friendship, because what Lavinia does is care about women like I care about women, their vaginal health. And if they have a vaginal health, good health or poor health, it can still be managed to enjoy a sex life, because that's part of a fulfilling life for many women, not for everyone, but if you want it, we want to help you have it. So with treatment, what can happen? You can, and this is by no means one size fits all, but for some women, she can get changes in sexual sensation following radiotherapy. Her vagina may be changed due to surgery. It may be shorter, for example, or it may be changed with chemotherapy and radiotherapy. She may have an early menopause. With radiotherapy, we often see a condition called vaginal stenosis, which means the vagina becomes less elastic and less lubricated. It's not going to stop you having sex. We can help you with that. As I mentioned, menopause. So menopause is due to either removal of the ovaries in the cytotoxic sense, as in when chemotherapy stops the ovaries working. So they're not actually removed, but they don't work anymore. Or if they are removed as part of surgery. And some women just naturally go into an early menopause. They may be on the edge of it just as they go through this treatment. This can result for some in pain during vaginal penetration. That vaginal dryness and atrophy that I was talking about with vaginal stenosis, that's what you can get with radiotherapy, is a common symptom of a normal menopause. And this can actually be worse for some women following treatment. When we talk about urogenital symptoms, what we mean is peeing more often, an urgency, you know, that key in the door and you're desperate, or UTIs, urinary tract infections, we can be more susceptible to those. And the last thing you want is to have sex if you feel that you're going to get a urinary tract infection after you've enjoyed yourself, can put you off. So we need to support you with that. The reason that can happen is when you get a drier genital tract. vaginal shortening, as I mentioned. So the vagina can often be a couple of centimetres shorter following surgery. You know, it shouldn't make a jot of difference. And we can talk about that as we go through today. Vaginal infections, we may find that we are more prone to vaginal infections or bacterial situations, changes, pH changes, such as thrush, for example, following surgery. And this isn't uncommon. And in fact, one of the pieces of work that we've done at the Eve Appeal is on the vaginal biome. You can find information on that on our website. And this is why it is really, really important that you choose the right support lubricant or moisturizer. Tons to tell you about that in a moment, to support your vaginal health. You can get changes to your vulva. Well, that will happen anyway with menopause, but it will also happen if we alter your vulva surgically. So you can see tons of stuff can happen. So how do we help you? Well, before I go into the vaginal moisturizer and lubricants, first of all, I'm going to listen to you. But to listen to you, I need to ask you how you're feeling. I need to ask you, how does your vagina feel? How does your vulva feel? Have you had sex? Do you feel like sex? You may not want to ask me those questions. So I need to ask you so I can listen to you. And Lavinia and I have talked a lot about this. We are very much the converted, which is why the two of us are on screen. Well, Lavinia's hiding. She's not hiding. She's just being really, really lovely and just leaving my face, but she'll be back in a minute because I'm going to get her to ask me some questions. But Lavinia and I talk to women and men all the time. Men are not exclusive to this, because for the majority of women, I am not being gender specific here, the majority of women that we talk to have a male sexual partner. But male or female sexual partner, we need to be able to talk to them too. So often when I'm doing couples counselling, I'll either be talking to the woman that loves the woman or the man that loves the woman, and get them to join in and learn about all the different ways we can support. Because generally for people, well, unless you've got a great vibrator, more about that in a mo, it's usually a two-way enjoyment situation. So we've listened, we've talked, and you've told me your vagina's feeling dry and not moisturized. Your vulva's actually so dry it feels sore. And even if you got to sex, it would be so dry you don't think you'd feel like it. So let's start with the top thing. Let's rule sex out for a moment. We'll rule it back in very quickly. Vaginal moisturizers. They're different to vaginal lubricants. So here are my menopausal. There we go, out and proud. 58, I think. The cognitive effect of menopause is a bit of an issue. 58, 59 shortly. I had a hugely dry vulva and vagina, really miserable, and just made me feel really, really uncomfortable. So what I do when I go into Boots or any other chemist or Lloyd's or whatever, not advertising any chemist, they're all pretty much the same, and they're open now, or the online chemist, I would go and I dismiss all the jars that had pictures of young people on them, because I'm not anymore, and I get to the 50 plus. And I would moisturize my face and do every day, and it makes a bit of a difference. And as long as I keep moisturizing, I'm comfy. Okay, let's just move down below the navel. I've got dry vulval skin. So if I moisturize that every day, I wonder what will happen. Bingo. I use a vaginal moisturizer. In fact, I don't need to use one every day now, either over the counter or on prescription. And it's made such a difference to my health and well-being of my vulva and vagina. I'm comfy now. How did I choose my vaginal moisturizer? In just the same way as I chose my skin stuff. I've got fairly sensitive skin. Of course, I started way too late and I'm very wrinkly, and we know all of that. I shouldn't have smoked and drunk and been in the sun. So there is all of that to the dryness as well. But when I choose my skin product, I don't want one that is going to make my skin itch, sore, come up in spots. I want something that's as natural as possible, that's not got any horrible things like glycerin, perfume, parabens, propylene glycols. These are all the chemically things that our friends at Yes and other companies too, it's not all about Yes, but that our friends at Yes have produced. And so it's gone under real scrutiny, that the ingredients, so that when I apply these moisturizers, and you can see a couple here identified on the top row of the picture, I can be pretty confident that I'm not going to be itching or scratching, and I haven't been, and they're absolutely brilliant. So start to get your vulval and vaginal skin confidence back and your comfort back. Right, got that. Now we're up and running. Now I might feel that I want to have sex, but I'm a little bit worried because the last time I tried, I may have had this shortened vagina, I may have a dry vagina. I may be very nervous because the last person that was in my vagina was a surgeon or a speculum or an instrument or cancer. So I've been invaded by all of these things, and now what I want to do is to have some penetrative sex. So I'm a little bit worried. What should I use? I'm moisturized. I now look at lubricants, and there are a number of different sorts, and you can see here WB on the yes packet on the left means water-based. OB on the yes packet on the packets on the right mean oil-based. All really safe to use. There's another product I like in the middle from our friends at Silk. That's also lovely and gentle. And you'll see in the two yes products that I've chosen here that you can either get them where you can apply and squeeze and put some on your fingers, or there's a really neat little little gadget, well, it's not really a gadget, an applicator there that you simply flick off the top and you can insert that into your vagina, so you can get actually the lubricant into your vagina. Such a good idea and so liked by my patients. So moving on, if I can get to move on, doesn't want to do the next, let's try. Here we go. So what have I got down the bottom here? I have got a variety of different devices that we can use to help you feel a little bit more comfortable and confident if penetration's painful. Now, penetration of the vagina may be by finger, it may be by one of these devices here, which I'll explain in a moment, to enjoy sex. It may also be when your doctor or nurse wants to do an examination or wants to put a speculum in so that they can check your vagina and your vaginal health. So as well as us wanting to help you enjoy your sex life, because that is so important if you want to enjoy your sex life, we also want you to feel confident when you're going to have examinations. So it's not just all about your sex life here, it's also that confidence in examinations. And this is where vaginal dilators or trainers, your nurses might call them, vibrators, also called sex toys, or other sex aids may be useful for you. So you can get the standard plastic dilators or trainers, they're available on prescription. So you'll see sort of right in the middle, it says dilator kit in those varying degrees of different pink dilators. And then to the right of those, there's a rainbow of colours of other different dilators. And then coming up on the screen, you'll see some other sorts there. One size simply, excuse the pun, girls, doesn't fit all. And we can help talk you through how to use these. Your nurse specialist should be able to help you do that. And if you're finding problems and you can't find your nurse specialist and you just want to talk to us at Ask Eve, absolutely no issues at all. Now, to make something easy to insert, you simply put some lubricant on. I certainly wouldn't suggest putting a dry finger, a dry dilator into your vagina. I would always use a lubricant. One of the things that I really, really rate is a kind of knack that we call double glide. I'll explain what that is. You'll see there it says use only water or oil-based lubricants with silicone products, and I'll talk about a few of those in a minute. They're on the left-hand side of the screen. That's because you don't want the products to degrade. Some of them are quite important, and you want to be able to enjoy them for years to come. So I'm going to take you to your kitchen for a moment. No, I haven't gone off piste. Imagine you're in your kitchen and you pour yourself a glass of water. And then you reach to the olive oil or the vegetable oil and you pour some of that on top. Now, I'm not suggesting you do this as some weird practice and start drinking it. What would happen to the oil? It'll float on the water, won't it? Yeah. So you imagine your vagina. Here she is. And you put some water-based moisturizer, lubricant onto your vagina. And then you've either got a penis, a finger, a dilator, a sex toy, whatever you want to insert into the vagina, If you put some oil-based product on it, and pop it into, when you're trying to pop it into the vagina, you get what we call the double glide. One will slide over the other. It's a really simple concept and it works brilliantly. So I hope loads of you will be ordering packets, ripping them open and going, yeah, hey, it works. And if it doesn't, and you want to chat it through some more, do talk to us at Ask Eve. So what I've also got on this slide, on the left-hand side, is we've got various other devices. We can call them sex aids, sex toys. So we're looking, going on the left, we're looking at a tiny, it's beautiful little vibrator. Very easy, very discreet. The pebble there, which you can see held in a hand, is also great for clitoral stimulation. And I'm not sure if it's quite ready yet. We'll have to ask Lavinia shortly. There's a new super oil that's coming out, clitoral oil, so which is also good to use with these products, as with the one above, another stimulator. So I'll quiz Lavinia in a minute on your behalf and see when that's coming on ready. Okay, so colleague of mine, friend of mine, professional, Samantha Evans is brilliant. She's a girl who really cares for your health and sexual well-being. She's a nurse, as I say. She writes blogs on sexual health and pleasure, and I thoroughly recommend having a look at her website. She's a great person and really has helped support women along the way for many years, and is a friend of us at the Eve Appeal, of course. So well recommended there. Here's another recommend for you. My patients are loving this. So if penetration is difficult, if the vagina is shorter, or if she's just nervous, or if he's just nervous, or her girlfriend is nervous about putting a sex toy into the vagina, this very simple concept, the O-nut, as you can see, is a set of, there are 3 rings. They're really squishy, as you can see from the pictures. And basically you put as many rings onto the penis, the finger, the sex toy as you want. And that will actually, in effect, prevent whatever you're penetrating or putting into the vagina. It will make it shorter and gives the woman and the person, whether it's a man with a penis, another woman with a finger or a sex toy, a lot more confidence. They're not going to hurt the patient. My patients have loved this. So you see, there's tons of stuff out there. Okay, help and support. We're here. Yes are here, the Eve Appeal are here, our cancer charity colleagues, Go Girls, our cervical trust charity, Joe's Trust, the 3 ovarian cancer trusts, womb cancer support, Macmillan, the Maggie centres. I do think it's important to talk to your nurse specialists about health physiotherapy. It's out there, sometimes you need to ask. Psychosexual therapy, we are finding there are more therapists out there, but you may need to ask. And the British Menopause Society are brilliant, and do have a look on their website. They help support the NICE guidelines, and Eve Appeal, actually, I was the nurse specialist representative on that. So there's lots of us out there that want to help you. And if you're too, I was going to say, it sounds like a challenge to be embarrassed. If you're not confident about speaking on the phone, simply email all of us. And this is how you do that with Ask Eve. There she is. There's Karen, my secret weapon. So Karen is the girl that had cervix cancer, had surgery, is now really well, and we'll talk about sex forever and ever and ever. And she's brilliant. She's half my age. So if you don't feel like talking to me and you feel like talking to somebody younger, talk to Karen. If you feel like talking to me, or talk to both of us. If you don't fancy using the phone, you email us on nurse@eveappeal.org.uk. And now I'm going to go back to my lovely friend Lavinia from Yes, who I talk to regularly about sex, then about sex, and usually about sex, and sex after cancer. Lavin, may I ask you to give me your secret weapon story? I suppose we ought to see how many questions we've got first, but I'm really keen if you were able to share your story, like Karen shared her, because I think it gives women confidence.
Yeah, I think that's really important. Shall we leave the share screen up there, or shall we go?
I will stop sharing now, and hopefully there.
Yeah, that's great. Then I can also see I can have a look at the chat as well in a minute.
Super.
Tracie, thank you so much for asking me. Yeah, I've been very keen to share my story because I think that it gives other people the confidence, but also it's about raising awareness. And when I told any of my friends that I had womb cancer, when I had endometrial cancer, which of course is the lining of the womb, none of them knew, they didn't even really know what it was. And then the next thing, of course, they said was, how did you know? And I said, well, I was actually very lucky because I've worked in this area for the last 10 or 11 years. I've been to a lot of cancer conferences. I knew that if you're postmenopausal and you have some spotting or some bleeding, it may be nothing, but it's always really important to go to your GP and have it checked. And so that's what I did. And I was very lucky. I definitely caught it very early. And actually, the first thing that the gynecologist said to me after I'd been diagnosed was, this is very treatable. And that was hugely reassuring, obviously. But it was interesting that I say, you know, there was very little awareness amongst my friends or family or anything. And so I was very, very lucky.
Thank you. Thanks for sharing that, Lavinia, because I think there is, you've nailed it. There is very, very little awareness. And I think as women, we bleed pretty much all our lives, every period. It only stops if we take the pill or we have a baby. That's a generalization. For some women, it stops due to stress, etc. And then we menopause. And so then when we have another period, which we shouldn't have, we normalize it. Unless you're someone like you that happened to have been to all of those conferences. So we need to make everybody else, someone like Lavinia, and hear that message. So yeah, so important. Thank you.
Yeah. So then the next thing was after. So I had a radical hysterectomy, which is a hysterectomy where everything is taken out: your ovaries, your fallopian tubes, your womb, and your cervix. And things were quite uncomfortable. You know, my vagina was definitely shorter, but I had to ask my surgeon to check in this sort of going back afterwards. And he was a great surgeon, but he didn't have the greatest bedside manner. And that was quite tricky, you know, quite formal. And I had to say, is everything okay? Because actually things are very uncomfortable. Could you have a look and see? And I think that was quite a challenge. I mean, that was a challenge for me. And I talk about sex and lubricants and vaginas and vulvas every day. So how difficult is that for somebody who isn't as confident as that? And is there any way, I mean, is there somebody that can ask us that? I mean, you're amazing, Tracie. Obviously, anybody that gets to see you has really, you know, struck gold, but not everybody is like that. And does every hospital have somebody who could ask that question?
I think you make a really good point there. So what we have done from the British Gynae Cancer Society and the nursing arm of that is we are actually, and it's in our conference this year, we are aiming to remind all nurses, because often it is the nurse that the patient will feel more comfortable talking to than the surgeon, even if the surgeon is female. And I'm absolutely not gender bashing the guys here at all. And so I think the key person is the nurse, who will actually see the patient more often and actually see the patient for follow-up. Any patients that are listening or friends that have got patients, it's also with the nurse, you have her phone number. So if it's a little bit tricky to say in front of the nurse who you've got to know, I also want to talk about sex or my dry vagina, you could actually do it by phone first and say, I'm going to find this tricky, but I do need some help. So I think the nurse specialist is key in this. I'm not negating the doctors, but I think the nurse is your way in.
I think that's fantastic. I had a lovely nurse and I did feel I could phone her up, but I wasn't sure whether that was the right question to ask her, and she didn't mention it to me. So yeah, I think the next thing that we should just perhaps do is we've got somebody who's asked a question on chat, Tracie.
Okay.
Is that okay if I go ahead? So the question is, I have vaginal atrophy following much chemotherapy and I'm using Yes product, but I feel I can't have a smear, a cervical smear, because they won't use a lubricant and there's no way the speculum could be inserted. Any advice, please? Having said that, I can't have any more chemo anyway, so is there any point in a smear?
Do you know, Susan, that's a you've raised two really good points here. So let's talk about that can't put lubricant on a speculum story. That's another one actually that Lavinia and I asked an awful lot of doctors and have done over the years. And actually the doctor is right to say, and you're right, Susan, to say you can't put lubricant on the tip of the speculum, because that's the bit that's actually going to come into contact with the top of the vaginal vault or the cervix, if there is a cervix in our patient. However, you can put lubricant on the side of the speculum, and the BSCCP, so that's the group of the professional group of doctors that talk about how to do smears properly and run the screening service, have okayed that. So that is something you can definitely say to your doctor or your nurse. Whilst you understand that it can't go on the tip of the speculum, it can go on the sides, and that will make a huge difference. You could also, and it's great to hear that you're using products, so perhaps increase the use of products before you go for that smear. Now, your point is, I can't have any more chemo, so is there any point in having a smear? That's a very specific clinical question, so I can't give you a specific answer, but it is definitely a question to run past your team. Because if your chemotherapy has been done with curative intent, or they think you may only have, and I use only in the very loosest sense, that you may get a local recurrence that could be treated again, which is why we do follow-ups, then yes, there's a real point in having a checkup. So I think you're definitely on the right track. You've got products on the go that are making a difference. You're really well informed already. I think you're going to be the ambassador that's going to go back to your GP or your nurse or your oncologist and say, I heard from this nurse that it's actually okay to put a lubricant on the side of the speculum. Please, could we consider doing this? Susan, I would love to hear how you get on. So do come back to us at Ask Eve if you would like to, and we can talk some more.
That's really helpful, Tracie, and that is a question that we get asked a lot. And what a sort of general recommendation that I think has probably come via healthcare professionals is there's no reason why you couldn't use a vaginal moisturizer for a couple of weeks before to help the tissue, and then feel, and maybe even try at home with a dilator just to feel that you are confident in being able to insert something yourself. That might be something that would be helpful.
Absolutely.
Yeah.
The other thing when it comes to inserting the speculums is there's no reason why you can't insert the speculum yourself. Oh. So Karen and I often talk to women who've never had a smear because they're frightened of that thing going inside them. So basically the speculums come in different sizes. And so you can ask for a virgin speculum. You don't have to be a virgin to use a virgin speculum. So if your anatomy has changed because of treatment, or if you're a virgin, you can still have the virgin speculum used. It's tiny. So,
and they're plastic too, aren't they? I mean, you think of those awful metal, cold, horrible things, but actually they're plastic these days, aren't they?
Absolutely.
That's really helpful. Thank you. Thank you for asking that question. We have now got another question as well, which is a little bit more detailed. I know this, this is from Helen. I know this talk is focused on the long-term impacts of treatment, but 4 out of 5 of these cancers are the consequence of a sexually transmitted infection with HPV. I need to check that. I didn't know that. Well, I need to check that with you. Surely we also need to talk about the prevention of acquisition of new HPV strains, particularly relevant for women who are single and wishing to return to dating at any age.
Absolutely, Helen. You're absolutely right. Prevention is so much better than cure. And you're right that HPV can cause the majority of the cervix cancers. It can cause a number of the vulval and vaginal cancers. We don't relate it to the womb and ovarian cancers. But as you're right, we've identified 3 of the cancers where HPV can be the mediator. You're spot on, Helen. And you're absolutely right. We do need to talk about that. And if you get to our Eve website, you'll see we wax lyrical about HPV. And in fact, in September, Lavinia and I party again in September. It's part of Gynae Cancer Awareness Month. You'll see that myself and Karen, my other secret weapon that I was showing you, she and I are doing a whole piece on HPV, and we are bringing out some information, detailed information on HPV, exactly echoing what you say, Helen. So do please visit the website. I agree with you totally.
And Tracie, can I ask you, while we're talking about HPV, to clarify the tests that are now available for us to do at home, which are, these are not cervical smear, they're not smears, but they are able to test for HPV, is that right?
So I'm glad you brought that up, because we're sharing with a number of our clinical experts to learn a little bit more about these tests. And in fact, it was a wonderful young woman who has asked to remain anonymous, so she will, who I was talking to through Ask Eve, who actually identified these self-tests to me, didn't know about them. And so it sounds very promising. But we do need our clinical experts to look at these tests, because we need to find out how specific they are. And also, if we have people doing these tests, it's how to follow that up and how to fit them in with the smear and screening program. So there's a lot involved, but it's great that there is an increased awareness out there. So that's a rather long answer to that question, and so we're getting clinical experts to look at that a little bit more. And that will also probably, it takes a while, we'll come out with our September edition of HPV, what's happening, how to test, etc.
Okay, we've had a question directly to us from the question and answer. I had TVT surgery for stress incontinence. Unfortunately, it eroded through my vagina wall after my hysterectomy for endometrial cancer. So now I have plastic mesh sticking into my vagina, which is pretty uncomfortable. My urogynecologist said there's no evidence to know if YesVM is safe to use in this case. I'm hoping to get Vagifem pessaries, but have to avoid YesVM sex lube due to infection risk and possible to make the mesh erosion worse. Wow, why would there be a possibility of a lubricant affecting the mesh? Is that something that's ringing bells with you, Tracie?
No, it's not. So TVTs are not my area of expertise, and I'm so sorry to hear that you're going through this as a patient. My question would be, if they're considering using Vagifem for you, why they won't consider using another actually safer, non-hormonal, proven to be compatible with the tissues moisturizer. So I think you might need to, as I'm not being critical of the doctors, they may well not be aware of what's not in Yes, if you see what I mean. So they're clearly wanting to help and support you. I think you need to take your packet, and I think you need to take the packet with all of that describes what's not in it to give your doctors confidence. And remember that it's prescribable. The reason it's prescribable is because it's damn safe. No hormones. So I think it's probably a lack of knowledge. So I think that's definitely something to share with your doctors. And I think also that sort of the not having sex because of the infection risk, etc. Well, that just sounds like a huge quality of life issue for you. I wonder if you could get permission to try. Is it because they think you might get an infection, or is it because they know you'll get an infection? What about sex that's non-penetrative? Can you have clitoral stimulation? I can't see from your clinical description why you shouldn't. Could you use something like the O-Nut plus moisturizer so that there's less penetration, so that your partner or device or toy doesn't go as far as to the area where the mesh is eroding through? So that's going to need a clinical support to see what the length of vagina is, what the safe length is before it comes in contact. So I think there's tons you can do there, or potentially but I would definitely start off with saying, here's the ingredients of what's not in Yes. Can I try it?
Yeah, the full list of ingredients is on every pack. And in terms of infection, it's pH balanced to the vagina, so it's fairly acidic. So unlike some products which may be too alkaline, there's less chance of having an infection if your vaginal biome is kept at that sort of pH level. But I mean, I think you're absolutely right, Tracie. Take the full list of ingredients and ask them why they think it might not be safe.
Good luck with that. Really good luck with that.
that was so we've had another on the chat on a different topic. Why do we still need speculum examination smears when we could self-swab HPV tests instead? I think, have you sort of covered that really in your...
Yeah, but obviously I wasn't clear enough. So the nub of it is we need our clinical experts to have a look at these HPV swabbing tests just to see what we call their specificity, just to make sure it's the same as what we would get if we were doing it on the NHS screening programme, and then also make sure that we could follow up women if they get a positive test. So it's a fairly involved, lengthy process. So the question is, it's not a no, but we need to learn a bit more about how good these tests are, I guess, before we say yes, go for it.
Thank you. Tracie, Julietta has asked, how do we know if you're experiencing vaginal dryness? What are you supposed to feel? That's actually a really interesting question because it is different. It may be different for everybody, and people will have different explanations of what they feel. But I'm going to ask you if you can cover that a little bit.
Yeah. Julietta, that's a really, really good question. So it's kind of like one of our things with the EVA pill, we go #KnowYourOwnNormal. So my normal vaginal, I would say, dryness or lack of dryness before menopause was, I used to get a little bit I used to wear a panty liner. I got addicted to panty liners, actually. Here we go. There we are. That was me, addicted to panty liners before menopause, because we all have a little bit of discharge, us premenopausal ladies, and then postmenopause, you can also get a bit of a discharge too. And so when I looked at my panty liner, I know you all look at the gussets in your knickers and your panty liners, so don't tell me you don't. You sit down there and you don't look at the wall, you look down, you do. So there you are. It's girls here, well, maybe boys too. So you'll see you get a different discharge in the gusset of your knickers, and mine was just like enough to go on so I change a panty liner just once a day. So that was my sort of normal moisture, and I wasn't aware that I had a vulva or a vagina when I was sat down, like I'm sat down talking to you. Then I went into menopause, and I was aware as I was sat down that I had a vulva and vagina, in that they felt dry. You know, like when you've been out in the wind and you get a dry face and it just feels uncomfortable and tight. Actually sat down, my vulva, not so much my vagina, I have to say, but my vulva felt dry. And actually when I was walking, I'm an avid walker, I kept the panty liners on because I was addicted to them, and I've owned up to that now. And they were scratching. They felt dry and sort of almost chafing. You know, like you get chafing on your lips in the wind. It was like that. So that was my experience of dryness. So that's when I started to use a moisturizer, and then I was comfortable again. And now sat down talking to you, I'm not aware that I've got a vulva. That's kind of like how I want it to be, unless I'm having sex, and then I'd like to be aware. But that's another story. And that's when the lubricants come in. Okay, so I hope that answers the question.
I think that's helpful. I think, yes, I mean, some people are so uncomfortable that they can't sit down, you know, listen to people who used to be able to ride horses and ride bicycles, and they literally can't do that because of the discomfort. And other people, it may just be a little tiny bit of chafing or something that feels, and the vulva, as you say, can be a big, you know, we're talking about vaginal dryness, but it isn't just vaginal dryness, it can be vulval dryness as well, that whole of that, which would have had a lot of estrogen to keep it nice and moist and supple and stretchy. And as the estrogen levels deplete, whether it's because you've got no ovaries or because you're postmenopausal anyway, that's when the changes come and you can feel some sort of dryness. I hope that's helpful. Somebody has said, have you suggested to combine the water-based and oil-based lubricants at the same time to help with penetration? I'm not sure if I understood you right. Can you repeat that part? I think I'm going to take that on.
Go for it.
It's really interesting. We do call it double glide. Now, you described water first and oil next. In fact, we tend to recommend the other way around, because we think if you put the oil first, you're getting the protection and the longevity. So that oil almost coats the mucosal tissue, the tissue of the vagina. And by putting water on afterwards, it slides over the top. Sometimes we say put the oil on yourself, and if you have a partner or if it's a toy or whatever, then put the water on the partner or on the toy. But I think it is quite important to put the oil on you first. It sounds really quite messy, but my goodness, this has helped so many people.
Yeah.
So yeah, double glide, we say oil first, but as you've pointed out, the main thing is that the two don't mix, but it's about creating a water-based lubricant on its own will get absorbed fairly quickly. A natural plant oil-based, and we are not talking about mineral oils, baby oils, it must be a plant oil. A natural plant oil will take much longer. And the lovely thing about the plant oils is that they do eventually get absorbed into the tissue. You don't have to wash it off. You don't have to get up from bed or wherever you are and think, oh, that feels, I've got to go and have a bidet or a shower or something. It will just naturally get absorbed into your tissue and feel really comfortable, which is great. We've had another one here. I saw the Eva Peel video about HPV in which Adiola Olaitin, I don't know her name, I know she's one of your ambassadors, advised that we do not tell our sexual partners if we're diagnosed with HPV, but I feel uncomfortable with this approach as it means that after short-term relationships, our exes unknowingly go on to spread HPV to other women. I also feel that it distances women from their partners and expects us to deal with the stress and anxiety on their own without support from their partners. I wonder if the Eva Peel might reconsider this aspect of their messaging.
So Helen, thank you. It's always really important when people comment, and I will take that comment back to the team. Not having seen that specific aspect where Adiola, or I can't sort of recall it, but we'll take that back. And Helen, if you want to talk to us direct to Eva Peel about that, it's really important that we hear everybody's voice. So thanks for your comment, and I'll take that back to the team.
Okay, and Helen, just going back to the prevent acquisition of HPV, I think it's a bigger subject that is relevant to today, but I wonder if Helen, whether it might be best for her to speak directly to the Eva Peel about that as a way of talking about preventing acquisition. I think rather than it seems like a really big subject that I certainly don't experience.
Yeah, and really, really helpful to have people like Helen on board to help for the piece of work that we're doing for September. So that's great timing, Helen, and we look forward to talking to you. Seriously, it'd be really helpful.
Right, I'm beginning to think that we may have covered quite a lot. Tracie, is there anything else that we should talk about, or have we missed out on anything?
Well, on one of our regular sex chats, people are going to wonder about us, aren't they, Lavinia? But actually, it's really, really important. We do chat a lot about what our patients feel and questions, etc. I know we were making a sort of a list. Have you got the list with you, Lavinia? Have you got any?
Yes, I have. I mean, we've covered the bit about how do we bring up the topic in a clinic, and could this possibly be before treatment to manage expectations?
I think so. I think it's really, really key. Now, there's a thing that we need to look after with our patients. It's called informed consent. So if you're going to have treatment, if you're going to have anything done, you need to have informed consent. So if a patient's going to go through chemotherapy, radiotherapy, surgery, anything like that, they need to be informed as to the side effects of a drug, for example, or the side effects of therapy. And I think an informed patient it's so much better when you get to the other side of the treatment that you know that actually, well, I might go into the menopause, I might have a shorter vagina, I might need, but there are things like lubricants, etc., that I can have rather than arrive at the dry vagina, shortened vagina stage and then think, oh my goodness, I wish they'd told me. So I think it's really important to have that conversation up front.
Great. And I apologise, there is a question that was sent in to us before from Caroline, which is really important. And also Sue has mentioned it in the chat about HRT cream. So Caroline's question was, I had chemo and pelvic radiotherapy in 2014. I've been offered estriol for a sore vulval skin, but I don't want to use a hormone cream. Can you suggest a non-hormonal cream? The oncologist has had a look and said it's okay, and a lot of people go to a gynecologist for late radiotherapy effects. Is it possible to have an appointment with your clinic? I don't know where Caroline is, and I don't know how that happens. But let's just, first of all, because somebody else has said that we haven't mentioned HRT cream, and they've been prescribed it for 6 weeks, but was alarmed by the list of possible side effects. Now, that is a big issue because even a topical local estrogen cream or pessary has a patient information leaflet in it, which is very, very scary because it's talking about the effects of, it seems to relate more to a systemic type of hormone or estrogen, rather than the fact that this is just topical. So are you able to enlighten us a little bit, Tracie, about certainly external topical estrogen cream for vulval issues?
Yeah, use it. I completely get the fear factor of around, oh, it's hormones. We say it all our lives, don't we, as women? It's hormones. And we actually sometimes, with all due respect to our lovely Eve selves, we don't actually know what we mean. And so we blame lots of stuff on our hormones. Now, we can, for some of the womb cancers, blame that on our hormones. So we would be right in that Eve sense because some womb cancers are promoted or mediated or started by excess estrogen. However, not all of womb cancers are. So if you don't have a womb cancer that has been started by estrogen, that is related to estrogen, there's no reason why you can't use any estrogen at all. Vulval cancers are not promoted by estrogen, so there is no reason why you can't use estrogen at all. And also at that point, I'm talking about eating it or systemic. Actually, what we're talking about here is when we're putting it on locally or topically. And there's been tons of work done on this, and it is quite safe to use. So if it's being prescribed for you, that's because your clinical team have looked at your clinical records, know how your cancer or your clinical situation was mediated, will have discussed it with other therapists if they're not sure, because a lot of doctors are, well, we're not sure, and that's really good practice. If they're not sure, they'll phone a friend who knows more about it. So if it's prescribed for you, it's safe. Do use it.
So it's case by case, and
absolutely.
I was able to use, even after an endometrial cancer, admittedly very early stage. I am still using. I'm back to using Vagifem along with Yes, and actually I'm also using a low dose estrogen patch as well. And I don't need to take progesterone because I don't have a womb anymore. So
exactly,
I think, case by case, but that's really helpful. So I hope we've answered that. Is it possible to have an appointment at your clinic?
No, sadly not. But you could always call or email us at Ask Eve and talk through the questions that you might need to talk through with your clinicians. And I think once again, it's often a permissions to just to find the right tactics to talk to your GP with or your doctor. We do have on the Eve Appeal website a sort of top tips about talking to your clinician. But if you want to talk to myself or Karen, please just get in touch.
That's fantastic. There was one other thing that I was going to say about psychosexual therapy. So we've talked about the physical aspects of difficulties and as a result of the treatment. Psychosexual therapy, really helpful. There are some fantastic therapists out there. You may well find that your hospital has provision. And if not, there are two organizations where you can find a psychosexual therapist. One is COSRAT, the College of Sex and Relationship Therapists. They have a Find a Therapist facility on their website. And then there's the Institute of Psychosexual Medicine as well. They have therapists all over the country. So there is fantastic support for the psychological aspects. And the other thing is, we said about menopause, if the menopausal symptoms generally are causing problems for you, then it is really good to go to a specialist menopause clinic, and you can find those listed on the British Menopause website. So
absolutely, Lavin. And I think if you can't find a menopause specialist clinic, because they're becoming more popular, it's quite often at your GP surgery or within your clinical practice. There's usually a doctor, and it's not always a woman, who is interested in menopause and the side effects or the symptoms of menopause, and there to help you. So just ask around.
Right. Well, we're up to 1:30. We haven't. I think we've covered just about everything. Please do use the Ask Eve service. It's fantastic. That it's amazing, Tracie, that you're able to give your time to that, and it's a wonderful provision. And great to have Karen there as well. I know she's absolutely wonderful. So I think it's really time to say thank you so much. What a brilliant talk, and thank you very much for your time and for your presentation. And I hope we'll find time to do another one, maybe in the autumn.
Most definitely. All right. So everybody get Lippy. Come and find us at Ask Eve, and Lavin, look forward to working with you some more.
And just to say, this is recorded. I will be sending out an email to everybody that attended so that they can see it again, and to everybody that wasn't able to attend but had registered, they will also get an email with the link. It'll take a few days for us to get it sort of edited and available, but we'll make sure that everybody has access to it. Thank you, Tracie. Have a brilliant week. And thank you, everybody.
Take care, everybody.
Thanks a lot.
Bye-bye.
Bye.